Here's one.
I think a good caregiver gets to know the client well, gets to know their needs, keeps them clean, keeps them fed, keeps them happy.
I'll get it back.
There are many clients happy with their home health care, and with more people choosing to remain in the home, business is booming. But with that growth has come an increase in fraud.
There's a lot of money that's allocated to this type of care, so they see it as a cash cow.
Ohio Medicaid spent an estimated $40 to $80 million on fraudulent or non-existent home health care in 2012 alone.
Most of these individuals who are victims, they don't pay out of pocket expenses. I mean, most of it comes from the Medicare and Medicaid programs. So they may not be aware of what's happening.
These are tax dollars. They're a finite amount of money. We want that money to go for people who really need help.
Officials see several common types of this fraud. Often providers will forge documents and bill for services that were never provided. Sometimes clients will sign off on the documents in exchange for kickbacks. Others recruit people for home health services, whether they need them or not, and receive kickbacks for the referrals.
It's difficult to detect because the services are provided within the home, and they realize that. There's a large population too that's the immigration population, the elderly population, two sectors of the population that are not likely to complain if something goes awry.
Home health agencies are popping up all over Central Ohio, but there aren't enough regulations in place to oversee the massive growth.
Sometimes in Central Ohio we've seen companies open that have really grown quickly, and they lose track of they lose track of where they're going here, and they just get into the billing end and not so much in the quality end, and that's when they get in trouble with the Attorney General's office. And we have a lot of dealings with the Attorney General's office, and we go back and forth and try and figure out who's doing a good job and who's not.
In North Linden, Diversity Home Health Care and Caron Home Care closed their doors after they were suspended from billing Medicaid. The state is investigating a credible allegation of fraud against Diversity, which shared ownership with Caron. Officials say it's difficult to catch home health fraud. They often rely on reports from the public.
We'll look for billing anomalies. That's one of the things we do. We often will at some point incorporate some type of surveillance to see whether services are being provided. But probably the best evidence that we receive is somebody within the community who contacts us and complains that they're not receiving services or something inappropriate is going on.
In 2013, the state tried to recover more than $10 million in improper payments, but that money is hard to recover.
While recovery is important, and it's an essential part of what we do, I think the most important thing that we do in our office is criminally prosecute these individuals.
While prosecution can be a deterrent, more regulation could also help reduce or prevent fraud.
It'd be nice if we saw a licensing board where these agencies were actually licensed, and there was a board there that could implement rules and regulations that would adequately regulate them, as well as doing on-site surveys, on-site audits, to make sure that they're providing the services that they're billing for.
I think regulation of the industry needs to happen, will happen, because it's going to be the predominant way of providing long-term care, and I think people need that confidence.